Hello, thank you for joining us. I'm Shawna-Kaye Lester, founder of Memorable Essay. I help ambitious people who are applying to college and to graduate school, graduate opportunities, especially medical residency and fellowship, to get their dream opportunities. We figure out how you're going to stand out, and then through doing that, we help you to get the opportunities of your dreams. Today, I'm talking with Darren Bodkin. He is a physician who has been successful in residency match. I'll wait for him to tell you which specialty as an IMG, and he has lots of great information to share in terms of his expertise and his experience in medicine and his experience in the match. So I'm just gonna wait to have him do a lot of the talking, and thank you for being here with us. So hi, Darren.
Hi.
Welcome. Thank you so much. All right, so could you start by telling us a bit, we've picked up an accent, but could you tell us a little bit about you, where you're from, and basically what you're doing right now?
Okay, so my name is Darren Bodkin, and I'm from Trinidad and Tobago. Graduated actually from the University of the West Indies, the largest university basically in the English-speaking Caribbean. So most persons graduate from that school, and my medical history or training was split in two. I started off at the Mona campus in Jamaica and then transferred to the St. Augustine campus in Trinidad towards the end of the rotation. But really my dream career path is pediatrics, and so I'm very, very happy to be able to start medical residency in pediatrics in the United States at SUNY Downstate in Brooklyn. So today I really look forward to being able to share with you how that process went for me, because it was a quite intense process.
Oh, yeah. Okay, an intense process. Absolutely. And so if we could dial back a little bit just to you starting medicine, because we're probably going to have some people who, yes, they're applying to residency, but also some people who are just coming into medicine. Like, who or what were your influences for going into medicine?
One of my main influences for medicine was my family. And to begin with, my mom, she has a history of thyroid disease, and I remember one time post her thyroidectomy, she had, I didn't know it was a thyroidectomy at that point in time. I just know she had a surgery to remove the mass in her neck or throat, as we would have said. And she had a crisis at home. Calcium levels had dropped terribly low, and she was getting spasms and that kind of stuff. And there's no other, at least within the generation now and before, of any doctors. So it was kind of interesting to see, even though she was very unwell at a point in time, that, hey, this is maybe something would be interesting. So to me, at that point in time, I thought maybe I'd just become an endocrinologist.
About how old were you when that was going on?
I was in my teens, so I was in secondary school. And I had a battle at around 15 or 16, thinking, just do engineering because I like to do, I was interested in engineering stuff, but I was thinking about medicine because of family experience.
Okay.
And that was it.
Okay. And so in terms of your training at Mona, and then you said some of your rotations, St. Augustine, what stood out from you? Like, what were the highlights of those trainings, especially when you started going through your rotations and kind of picking up on what you liked and what made you feel fulfilled?
Well, first off, for me, the cultural experience was a major part of my learning process. So at Mona, I lived on the best hall, Chancellor Hall. And that's where I met a lot of my friends. So a friend of mine named Jovan, who is Jamaican. Right? Another Trinidadian classmate, Richard. Another Jamaican from St. D, Damien. He's actually still in Jamaica now. He's in the postgraduate training program. And a St. Lucian friend of mine, who's also in Trinidad currently right now, studying emergency medicine. So we had an actual diverse group of nationalities. We would come together, cook different types of meals while we're studying medicine
Yes.
And yeah. So we would rotate whose dorm room we go to study the anatomy and physiology. And it was our automatic group for late nights, go into the anatomy lab,
Mm-hmm.
which was kind of on the opposite end of campus, to study and practice looking at the anatomy, looking at the histology, because we had access to the slides as well.
Okay.
And that was a real, I would say, a real bonding process for me
Mm-hmm.
in medical school. And that stood out because that took us even to the clinical years. So when
Mm-hmm.
one person, if one person found an interesting case, let's say there was someone with a cardiac murmur that
Mm-hmm.
is pretty uncommon to hear, automatically, okay, the message is sent and all of us grab all things and then we go meet our friend, whoever found it on the ward, and
Mm-hmm.
we examine that patient together and go through the history. So to me,
Okay.
the cultural experience leading to not just how we interact with each other
Mm-hmm.
in Jamaica,
Mm-hmm.
hanging out, but also on the ward for sharing the learning experiences, and it worked well.
Okay, cool. So that's interesting. Actually, no one has ever said that to me before in terms of the highlights. I don't know, normally people say, well, it was the first time I heard this or the first time I saw this, but for you, it's definitely about relationships. That's really cool.
Yeah,
Okay, and
yeah,
you guys, a lot of you are still friends, right?
exactly. In fact, my good friend from St. Lucia, who is practicing in Trinidad, right? So I'm
Mm-hmm.
the godfather for his son.
Ah,
And then the other friend of mine who this whole match process started as a group.
okay.
So I was the first person to mention it. It's very interesting, even though I wasn't the first person to match.
Okay,
Right.
got it.
So my friend from Jamaica, he matched before me, but we all talking about what we want to do for postgraduate training. It's like, let's see if we could do something outside. And then we all started doing it together, basically.
Okay.
And now three of us were interested, three of the four. As I said,
Mhm.
one of my friends he's in postgraduate training at Mona campus.
Yes.
But the three of us who went through the process, we matched.
Okay.
Yeah.
Amazing. All right. So tell me a little bit about that. What was your motivation for deciding that you wanted to apply to residency in the US and go into the match process?
The match process, there are a couple of things. One good thing for me about the match process is that they admit you directly into a training program. So
Mm-hmm.
other systems, when you analyze other systems, UK, because it's opening up more because of Brexit, Australia, they
Mm-hmm.
had a lot more openings because they had a particular need for specialized staff that they're trying to recruit. Um,
Okay.
but when they recruit you to work as a physician, which
Mm-hmm.
is completely separate from working as a resident
Mm-hmm.
training towards a specialty. So
Right.
you're recruited to work at the hospital, and then once in the system, you apply to train. And so that was the first thing that for me, that stood out for us. All of my friends, we wanted to start training in a particular area of focus.
Okay.
The other advantage to it is the way the exams rolled out. It was pretty similar to our medical school training and
Mm-hmm.
what we currently practice. So we were able to actually do the exams from a practical point of view.
Mm-hmm. So basically,
And
as you're
was
studying the material, you can take the step because the material is fresh.
yeah, yeah.
Okay.
No, we didn't. We took it graduating from medical school,
Okay.
but because it wasn't too far off, it still felt
Right. Okay. Right.
because we were all within 3 to 4 years of graduating from medical
Graduation.
school.
Mm-hmm.
And so the match really realized itself as the best option.
Okay. All right. And so you applied to pediatrics. So tell me a bit about the job that you had slash have that helped you. You're still in the job, right?
I am.
Yes.
Until May.
Okay, cool. So tell me about this job that you have that made you want to focus on pediatrics.
I would even go back to internship.
Okay.
When I worked as an intern, we
Mm-hmm.
rotated through different departments.
Mm-hmm.
And then pediatrics was the first experience for me where counseling sort of started to make sense.
Mm-hmm.
And that's because for me, adults, you still have the full authority and power to choose, willpower, right?
Mm-hmm.
So if you have COPD and you just love to smoke and you don't want to stop smoking, hey, you're going to smoke and then you're going to have at some point in time some problem that will bring you back into the accident emergency department. If
Mm-hmm.
not the smoking, really, you know? So pediatrics allowed me to be able to have some sort of input in helping someone make better life choices. A lot
Mm-hmm.
of times, more so than adults, and that was something that was very interesting to me. And
Okay.
so when I moved to where I'm currently at the neonatal intensive care unit at
Mm-hmm.
Tertiary Hospital in Port of Spain,
Mm-hmm.
we specialize a lot in premature babies.
Mm-hmm.
And I had no idea that that experience would have been so fascinating in terms of working with basically life that previously would have been ignored,
Mm-hmm.
meaning viability and what we deem acceptable to even try to resuscitate, to even give an opportunity to put on a breathing machine and give life has changed. So these targets have moved. We we now find ourselves being successful with babies who are 26 weeks.
Mm-hmm.
When about 10 years ago in Trinidad and Tobago, we would have just given up on them and said, hey, we can't do anything for you. And I found that the experience working in NICU was something really not only uh, physiologically important, but it was sort of like a spiritual experience, and if you could put it in that way, because you made a real difference in some parents' lives, particularly
Yeah.
someone who they've been trying for a long time
Okay.
to become pregnant,
Mm-hmm.
went to in vitro fertilization, which is very, very expensive, and
Mm-hmm.
if finally got a baby, it's priceless, and
Yeah.
I enjoy that about pediatrics.
Okay. Oh, well, yeah, that is amazing. Well, obviously, I have a lot of female friends, and people
Yeah.
have lots of different reproductive health
Yep.
experiences and outcomes.
Yeah.
And a lot of times we don't discuss a lot those outcomes, but obviously the in between portion when people are trying to get it right,
Yeah.
having amazing physicians is really important. So, okay, great. All right. And so on your first attempt at the match, you were not successful. Could you tell me how you handled that? How did you react to it and how did you cope?
That was tough.
All right.
Um, I remember asking myself, should I even bother after the first time?
Mm-hmm.
And I, luckily, I think I was on vacation at a point in time, so it
Mm-hmm.
was it was good. I was able to have some sort of distraction.
All right.
But a good friend of mine really encouraged me. She matched to a school in Florida.
Okay.
I was discussing the process with her, and she's one of the persons who really strongly recommended reapplying
Mm-hmm.
and doing some things differently
Mm-hmm.
to boost, basically to boost the application. One of them obviously was coming to memorable essay,
Okay.
which
Yeah.
was a recommendation from someone else.
Right.
Um, and well, there's a lot I could say about that. I don't know if we want to get to that point now, because I mean, the experience with the application documents that I
Mm-hmm.
had before pre-memorable essay and post-memorable essay,
Right.
it's like
Night
a
and
white
day.
person and a black person. Like it moved from a white person to a black person. That's impossible. Well, yeah, it actually did happen. Yeah.
Oh, unless you're Rachel Dolezal. Yeah, we can talk about that for sure. But in
Yeah.
terms of
So,
coping, so you say it was this
so
friend
yeah,
talking with you and saying, hey,
yeah,
give it a second shot.
definitely, yeah.
Okay.
So an encouraging word from my friends who matched and believed that I had the capacity um, in terms of not just the scores, because it's a multifaceted kind of system. Scores are
Mm-hmm.
very, very important. The better we score, your chances definitely is
Mm-hmm.
increased. But even for someone like me who didn't score as well as you would have liked, because of the multifaceted approach. And my friends believing that I had other components I can bring about in terms of my work experience, my work ethic that would be reflected in the letters of recommendations, and some of the work experience items that I did not at all enter in my previous application. They were like, never happened. They disappeared. Like, you know, or went into a vacuum in space. So that person knowing me personally and mentioning these things then said, nah, I think you didn't give yourself the best foot forward, try again. And that really lifted me up at that point in time.
Okay, amazing. Good. Because I always believe, you know, I had spoken with another physician, Andre Morgan, and so he said that someone told him that, you know, the only people who don't match are the ones who stop applying. So I definitely believe in, well, it's two things, like going at it until it happens, because there's so many people. I didn't know also until some applicants explained to me that there are individuals who just don't, you know, match ever, just ever, period. Or they just go and get another job, which is okay if that's what you want to do, you know, but the idea of completing this medical training, and for me, even because time is my most valuable asset, it's not even the money, it's all those years, and then not because you want to, but because of some other reason you don't go the whole way. I can't even you know, imagine it. It's so anyway, I'm glad that you had that friend to kind of stand in the gap for you and to tell you to go again. So the application, though, we are going to talk about that and about memorable essay, because this is something that I will explain to people a lot, and they might not necessarily believe it, but you can take the same credentials that you had in year one and change basically nothing, you know, unless you went to like throw stones on a beach for a year, right? But let's just say you're in a job, right? And we bring back that, and maybe, you know, if you had a good case for why you were throwing the stones, we could hear you out, because sometimes we need to rest, you know. But anyway, like, let's say you do something in the year and you essentially bring the same application back and just change the way that you're talking about what you bring to the table and your motivation. You know, fix your CV, ensure that your letters are robust and they don't say things like Dr. Bodkin is a nice person. You know, you will have a night and day outcome. Absolutely. And I think, without putting words in your mouth, that's what I found with you. But if you could just talk with me and for everyone else about your experience working with me and just what you came to learn about the application.
Yeah, I learned the importance, and I thought I knew, but I learned the importance of communication. And the match process, to me, I've realized, is largely based on communication. So, as I said before, I mean, I believe now that even if you have a good score, if you do not communicate your overall profile well, you'll be in some problems. So, for instance, one of the first things I remember going through with you in the process is the essay, the personal statement.
Right.
So, for all of you writing your personal statement, one of the first errors I had was it was titled personal statement. So I mean, they said to make a personal statement, right? You see it. So when I sent what I had done from the previous day when I did match to memorable essay to you, Shawna, I mean, that was the title of personal statement. I remember you asking me, so, but what is your theme? And I was like, what theme are you talking about? So, and when we talked more about what I wanted to do and what was my passion for it, and then we were talking about pediatrics and my experience as a junior house officer seeing a patient with a congenital cardiac disease and how that changed my perspective. And then, you know, we talked about it and we gave it a context in terms of, you know, pediatrics. So that's the first thing. And that made me realize why my first statement may not, well, it probably would not have been the best, because without that context or that kind of, this is what I'm trying to convey, the message I'm trying to convey, I would not have been able to in this body of the essay really, really reinforce what I want to do, why I want to do it, and why I think that the person who's applying, would be the best person to choose to train in your institution, wherever you're applying. And so that was one of the first things that stood out for me, making sure you really contextualize your essay and not make it just bland or generic, which is what I thought I had before. And then other components for me in the body of the nitty-gritty of the documents that we fill out on ERAS. So, Shawna, you remember when I sent you my ERAS document?
Right.
You remember the first question you asked me? I don't think you remember, but one of the first questions you asked me is that, where's the rest of it? I didn't even think you remember. Because it was that short.
Oh my
God. You asked me. Yeah, I remember vividly. You asked me.
I remember at the time, I was like, I think there must be an error. I think you sent me the wrong.
I think it was the email, and I was like, yeah, that was it, right? So simple things like my internship experience, I didn't put how many hours I really spent in those rotations: general surgery, orthopedics, pediatrics, and the experiences contained therein, and when we filled it out, when we went through the details, we realized that I had a lot of experience with going to the clinic. So continuity clinic, which is a big part of your training in residency, and following up cases that were of interest. And I was able to include a few interesting cases that I had, which I, again, completely omitted. Didn't think it was important for whatever reason. And fast track into the experience where I'm currently at the NICU, and I was able to include a lot of stuff about what I currently do there. And again, following up the babies who are discharged, preterm clinic, techniques that I've learned, talking about cranial ultrasounds as an emergency diagnostic procedure when we have a concern with a baby who may have had some sort of drop in their blood count, and we're concerned that they had a bleed in the brain. That's an important thing to mention that you could do, if you could do it. And by the way, it didn't come up in the interview. But, I think it made a difference. I really do.
Well, it landed you the interview. Yeah.
Sorry?
I'm saying, well, it landed you the interview.
Yeah.
Basically, if somebody knows the clinical skills that you have, and as a non-citizen, IMG, you have to know what your advantages are, right? So if you have these experiences, I'm automatically talking with a peer. So it's like if I were talking with an admission consultant, or like another medical admission consultant, or another communicator or something, with every field, right? There's inside language, there's jargon, there are experiences. So the minute you start to speak to me about stuff that you have done and things that you can do, I'm already seeing you as a peer versus somebody who I'm going to have to bring up to speed on certain things, And so that's why it's important.
I just want to include one other thing that we talked about during the process, and we eventually included when I talked about the volunteer experience in terms of I worked with my units, the NICU, to start a website.
Yes. I was going to talk about that. Yes.
Right. So one of the parents had this concern about how we communicate information. I mean, everybody's on a smartphone, and they feel like this information should be readily available. So you could preempt your anxiety to know what to anticipate when you come into a NICU. And so we got it done. We actually the hardest part is the bureaucratic phase now, process with getting that set up by the RHA. But the point is, most residencies, I think all, is part of the AAP curriculum, as quality improvement projects. So when you suggested that, Shawna, and we added that to one of the experiences, I believe how it would have been interpreted in the mind of the program is that, okay, this person is already interested in quality improvement exercises or stuff that you have to do.
Yeah, absolutely. And I could not believe that you didn't have that. Like, obviously, you know me by now, so I'm not bashing you. I was like, what? Website? Because there's so many levels to that to me. As in, a patient complains or says something, one, you listen, right? You actually listen. You took that. 3, you did something about it. 4, you rallied other people around it. 5, this is now at the level where like the Ministry of Health is involved and is trying to help you. And then the patients are going to have this service. So there's a lot of, there's admin in there, a lot of work that you're doing in addition to your regular practice. But I personally thought that that spoke so loudly about you. And I guess because I also have a bias for people who take initiative, I was just like, problem solver. Who would I want on my team? Who would I want to hire? I want the problem solver who's going to be like, oh, this doesn't work. Patient is displeased. Here is solution. You know, let's implement solutions. So I loved it.
And so
that was really great.
I think one of the important things I would stress to someone who is contemplating working with Memorable Essay is that I recognize that I did not assess the value and importance of my experiences in the minds of someone who is considering someone for potential spot in a graduate medical education program. So yes, I knew at the point in time that working with this parent to get this website set up was important, but my mind did not translate that to the importance to an admissions team thinking of, okay, they interpret this to mean, hey, this is somebody who might be a problem solver. A parent would have an issue and they would listen and they would want to approach the administration about it. Because guess what? I kid you not, in my interview, they asked about what I would want to contribute to the program and asked about any concerns. And they had a package that includes something about going out to less developed countries, actually to talk to people about pediatrics. And speaking to the program director, she was saying to me that if you come with them with a proposal about wanting to improve community health, they will listen. I was so shocked that they actually, so I now see how it matches up.
Overlap.
Yeah. So it's important. It's really, really important. And I'm so thankful for Shawna for giving me that advice to include those things, because I had no idea that it meant so much to the programs who are looking beyond your academic ability.
Yeah, absolutely. And a lot of times it's things that you already have. Like you had all these things when you applied the first time, you know, but it's just how you look at it. And as you're saying, how you're communicating it. Because also from a medical standpoint, you know, a lot of times now, even I'll go to physicians and they complain that, oh, you know, everybody's a doctor because there's WebMD. So there's that. There's also the issue of misinformation, where if you are not proactive about informing a patient, they're going to find out anyway and make their own decisions. And I know because I do it too. And then there's actually communication on the team in terms of when you look at the major causes of medical errors in a medical setting, you know, especially in the US, how crazy that can get legally. Communication is a very big deal. So having people who do not know how to communicate well, it's not a superficial thing. It's actually something that can have very dire consequences for patient outcomes and even just for the operation of your hospital or for your community program or whatever. So it's just essential. And I think that for you, like that was your gem. I always talk about these gems. So you had all these other stories, but I thought that was the example that was like, he's the one. So, you know, I'm really happy about that. All right. So could you please do the big reveal and tell us where you matched and what you're looking forward to? Even if you don't want to share the name of the program, I don't know. Sometimes people are like, oh, whatever, you know. But if you want to tell us where you matched, you know, hopefully no one stops you. And just tell us. I saw you and I'm going to come to your program. But tell us about the program and tell us what you're really looking forward to in training.
So I matched to SUNY Downstate in Brooklyn. Woohoo!
Woohoo!
I'm really excited, actually.
Yes.
The SUNY Downstate is actually connected to the Kings County Hospital. And anyone who's aware of that hospital, it's huge.
Yes.
Massive.
Ginormous.
They have a massive patient population based in Brooklyn, New York, which is very diverse too. Right? So I'm really, really looking forward to working in that population because of the diversity. I mean, for instance, they have a lot of Jewish people there.
Mm-hmm.
So for all the physicians out there, you know already, different ethnic groups bring different issues unique to them. So it's
Mm-hmm.
going to be a very, very, very good learning experience. Hispanics, um, Jewish persons, you name it. You're going to meet
Caribbean
different
people.
Caribbean people,
A few.
you know, a few, mini. But what I also look forward to from the experience in the interview is their role in or their interest, because the program director has a very strong interest in community health. I like that a lot, because it adds that importance of advocacy.
Mm-hmm.
And it's something that I am actually currently very, very much engaged in. I really enjoy the opportunity to hear the issues that parents would bring
Mm-hmm.
and see how there's some intervention that could be done, even if it's sometimes socially, because sometimes we do have issues that pop up.
Mm-hmm.
It's a medical problem, but it's fueled by a social need.
Right.
And I really look forward to that experience at SUNY.
Mm-hmm. Yeah, okay, amazing. And congratulations again. I know it's a lot of work. All right, so for somebody who is contemplating applying to the match, or they're actually applying to match 2019, we're going to be very specific, right? Because I like when people speak to what they're able to speak to. So I want you, as somebody who has applied to and successfully matched to pediatrics, to a peds residency as a non-US citizen IMG, to give us some tips. Like, what are 5 tips that you would tell somebody seeking to get into pediatrics residency? Any 5, your top 5.
Okay. Well, I will always start with, you score the best that you can.
Yes.
Don't limit yourself to a number. You're going to go into that exam and aim to pass one on your first attempt with the highest score possible.
Okay.
The second thing is that if you have some difficulty with writing and with conveying your message, you really, really need to get a good editor. Now, I would be biased because, of course, I worked with memorable essay.
Right.
But I'm just strongly suggesting that the way you communicate your personal statement and your experiences is critical to the interviews and the number of interviews that will be made available to you.
Right.
One other thing the third thing that I would suggest, and I didn't mention it when we talked because we added that component after, was research experience. And I'm actually in the process. When we started this process with you, Shawna, I started 2 case reports that we were sending to, actually it's a journal based in Jamaica, medical journal, sending to, right? And even if you have participated in research locally at your hospital, let's say you had a research day, you should include that. I mean, it's fantabulous if you've been published. That's excellent. That will do a lot for you. But even if you have not been published, which is one of the things that we worked on, Shawna, we included that in my application, and that was another good marker for me in terms of going through the process.
Okay.
Fourth, and I don't mean to necessarily put it in that order, say it's not that important, because it is, but connecting with people who are in programs in the States is important. It's like, it probably should be number 2.
Super.
I don't know. Yeah,
important.
It's super important. I cannot overemphasize how important this is. Okay, so you're going to school with different people from probably different countries, like I did when I was at UWI, and different people at different stages in life. So some persons may have started this exam process during medical school, some after. But keep in touch with people, because if you have classmates who are matched to programs, even if it's not a program that you are interested in, but they're matched to programs in the States, the resident perspective is important, all right? And their contribution to the incoming class is important in terms of how they think this person is, their attitude, the work ethic. So
Major key. You're giving all the secrets, Darren. Major
key. Yeah. They can't, it's not like they could guarantee an interview, but I'm just saying they can make
They
a
can
good
help.
impression. Yeah, they could make a good impression. So definitely. And I remember, Shawna, you and I, we talked about this, and that is something that is definitely key.
Mhm.
Um, and then I think definitely the interview is a important thing, but I mean that is post your successful matching. Apart from that, I think those are the main things I would say you should definitely go for to
Well, the
improve.
interview is a huge, so it's like different when the program directors speak and you, sorry, did I cut you by the way? No, I
No,
just wanted to, oh,
no,
okay.
yeah, very good.
So there are different things at different points, right? So you want that memorable application or that really high quality application to
Yeah,
actually land the interview. But then
right.
when it comes time for them to make their rank order, it's like that interview is extremely important because it's not that the written materials no longer matter, but there are different things that are leading at each step of the way. So what is most important? Everything. That's how I look at it. Like every single thing.
Yeah,
I'm the kind of person who the email communication to the program is important. You
yeah,
know, the what you wear, the how have you spoken to the people in it, sort of thing. And the aim is not to be perfect, but you want to be consistent. So what's in your personal statement should be on your CV, should be what you say, should be how you present. So it's like you want that
yeah,
consistency. Everything is important, but at different periods, there are different things that are opening the door to the next stage, right? And so when you get to an interview stage, yup, to make it to the top of that list, you know, outside of the other things, you know, like based on where you train and so on, when it comes to making it as far up as you can, you know, all things considered, the interview is extremely important. So actually, I'm just going to ask you quickly, could you tell us a little bit about how your interviews went and any major lesson
mhm,
that you had from interviewing?
yeah. I wanted to give a point to that interview that will actually reinforce what you said about your message being consistent.
Mm-hmm.
Very, very interestingly enough, in one of my interviews, and the program director asked me to share an interesting or something of concern in pediatrics that he would like to address. And
Mm-hmm.
uh, currently, because of the government instability, or what do you call it in Venezuela, which is basically our neighbors, we
Mm-hmm.
have a lot more persons seeking care. Okay,
Mm-hmm.
basically, kind of like almost under the radar immigration kind of thing, kind of
Mm-hmm.
sneaking they're pregnant
Right.
just for only time to deliver. Fine. And I thought that, we really need to work with this whole issue. We close our eyes to refugees and the thing, but it's there. We see them in hospitals. It's just we don't, the state doesn't do anything about it. And guess what? My
Right.
program director, who I was interviewing,
Uh-huh.
identified with that because she is from the Dominican Republic.
Ah,
So
nice.
as someone who is a Spanish-speaking country orientation
Mm-hmm.
and Latin American
Mm-hmm.
family roots, basically, because she was able to really, uh,
The
you know,
politics made sense to her.
like, wow, this person is thoughtful, is interested. So I just want to say that being true to yourself with what you said, Shawna, is very, very important because it don't try to fake too much of your personality, but try to be, of course, respectful and fairly composed, but still be you so they could see the real person they're going to meet. So
Mm-hmm.
in our interview, there were probably 16 of us in a room, and we had the opportunity to mingle and interact with one another. Uh,
Mm-hmm.
and then, of course, they took us on a tour.
Mm-hmm.
I think the tour with residents was very, very relaxed. And it's an important time to really be comfortable to ask some questions about the program and life in the area where the program is based and how to interact with or navigate certain challenges that may arise. Because, for instance, we had one resident sharing that he had a child and how he deals with that and that kind of stuff. So in the interview, depending on if it's the residents you're interacting with
Mm-hmm.
or faculty, your temperament will have to change a bit.
Mm-hmm.
Okay, so with the faculty, we would have asked more direct questions about the program and what benefits we see that we could add to the program.
Mm-hmm.
Don't ask the faculty about salary or,
what can I get? Get.
Yeah. And who's the best person to work with to get a letter to go to the next big university when to be a fellow? Nah.
Mm-hmm.
Really try to talk about what you want to bring to the program. And that would be a very, very important impression that you can leave on them.
Okay.
I think that's very, very important. It's important to be culturally sensitive because you would find yourself interviewing with persons from different countries. I met a guy from Pakistan, and as soon as he heard my accent and realized I was from the Caribbean, he started to ask me about cricket. Instant, like people thought we knew each other from before. No.
Sports, the game.
It was just, yeah. So it helps. So those are things that I think are important because apart from they wanted to train residents, we have to live or get along with each other for 3 years. I mean, we have to be able to commingle. And that's an important part of joining their family. Basically, is what they say in their letter when they say welcome to the pediatric family. They literally say that actually in black and white. So it's important to have that dimension, that component to you.
Absolutely. And so it's the cultural sensitivity.
I think
go on.
I was going to say one interesting thing. I had that experience at one place I interviewed where the program director, her son was in the office. It's kind of weird.
Okay.
I didn't know what to expect. I don't know if he was kind of assessing us as well. But I mean, you may have some weird experiences during the day.
Was it a son, like a baby, or like a resident?
Like a college student. He was not a physician at all. He was just hanging out with moms for the day. So, I mean, everyone when we came back to me was like, did you guys see her son in the room? So she asked if it was okay for him to be there. So you may have some weird, kind of experience, but just roll with it, okay? Yeah. Don't get flustered. Everything will be okay once you just, you'll be okay.
Got it. Yeah. And so, no, I think that's true. The cultural sensitivity and the flexibility, because you never know what's going to happen on the day. Like you might think you're going into one person and you go there and you're like, hey, time is short. We're going to do a panel, so being flexible. And something else that has come up recently in my conversation with others is being sensitive towards the fact that these people are in a program that they work in and they love and they run. So even if you're asking questions about the program itself, or if something doesn't seem right to you, you want to make sure that those questions aren't disparaging, sort of like, why isn't this better? Or what do you guys plan to do about this? I feel like those are questions that you can save for another time by just acknowledging that they are working hard on their program. And so even if you see things that don't look ideal to you, to be very sensitive or just aware of how you ask those questions, if you ask them at all, because chances are you can go and Google that or ask some other resident or somebody. You probably might not need to just bring it up in front of the interviewers and start asking them about when are they going to fix this and that.
Some of the programs may be quite frank to even admit, well, this is an area that we're working on. Actually, we don't think that we have the best, and they've been able to actually address that. And you're quite right. I mean, even with the residents, you should be careful how you go into those that kind of questioning. Definitely, faculty, no, no, and the networking experience that the interview brings. Again, when you're going to the interview, you're not sure exactly who you're going to meet until that day actually happens. Okay? I was fortunate that at one of the universities that I went to, the deputy program director was Jamaican, graduated from the University of the West Indies. So she instantly identified that, hey, I'm familiar with your school. I'm familiar with where you're
Yes.
from. So how do we deal with that? There was one colleague who, and I say colleague because we're all interviewing colleagues in medicine. Uh,
Mm-hmm.
we were going to the clinic, and he wanted to. We all trying to impress the people that we meet, so we wanted to say hi and talk a little bit longer. But we almost got lost and missed the group. And we was like, wait, hey, where's well, let's call his name Frank. Where's Frank?
Mm-hmm.
And you don't want that to happen to you as well, okay? So that
Mm-hmm.
you lost the train of where everyone is going if you're on a tour and because you're trying to talk to this one.
Mm-hmm.
So I know it could be nerve-wracking, but I believe if you have a good application package, personal statement, because you've done your best, you've have beautiful editing by memorable essay,
Mm-hmm.
right?
Right.
And you'll go in with a little bit more confidence than if you didn't have before, honestly,
Mm-hmm.
because really, Shawna, what you have in the application package
Mm-hmm.
matters. Remember the case we wrote in our personal statement about the
The
baby with
blue
the...
baby.
Yes,
Mm.
I was
Yes,
asked about it.
of course you were, because it's an
Yeah,
amazing story.
yeah.
Oh.
She literally asked me about, um, because I included when I went to cardiac cast with that baby for the definitive diagnosis and what did I see. And it again, it all ties into them seeing you, okay, as a colleague that it could relate to,
Mm-hmm.
as opposed to someone who just wants a job.
You're a nice guy,
Basically.
you don't want to be a nice guy, that sort of thing. And I often say that to people as well. It's so when I'm thinking of these documents, there are multiple levels that you think of it on, because a lot of times people come and they're like, oh, I want to make sure that my grammar is good, and obviously you don't want to be like, hey, I'm a red flag for lawsuits by having all of these errors. So you
Right.
want to make sure that it's clean in that way, but that's one level. There's so many different levels in terms of like your story branding, the public relations, the communications, because what you're doing with it also is planting seeds for the interview. And
Yeah.
oftentimes that's something that people will see once they get the interviews done. But when I'm looking at the statement, I am actually imagining the question list from somebody who read it very closely. And I'm
Yes.
also imagining like the question list from one of the skimmers, somebody who's like, yeah, I like them to come at me fresh. Let me just pull one or two sort of thing.
Yeah.
So for me, it's a very technical thing that happens on many levels, but absolutely your personal statement is planting seeds for your interview.
Yeah.
All right, so my final question to you is, what do you want your legacy in the field of pediatrics to be? Like, what do you want your greatest contribution to pediatrics to be? What do you want to be different in the world, I guess, because you became a pediatrician?
I would love to be able to assist, particularly with developing countries, address mortality rate
Mm-hmm.
and quality of life. So we look at, particularly when you look at standards of health, neonatal mortality rate, for instance,
Mm-hmm.
and to be able to work with an organization such as Pan American Health Organization or WHO to really assist in making countries achieve, or helping, those countries achieve those targets would
Mm-hmm.
be something that is, it'll be good. I feel really, really happy to contribute towards that.
Mm-hmm.
Um, and so it's so strange because I think a lot of the times it's really just about, it's all about leadership. And I feel that residency has a lot to do with that.
Mm-hmm.
We all have to get the information, and then we have to then go out and lead communities. Even within United States, which is developed, there are a lot of underdeveloped areas
Mm-hmm.
that, because New York is like a big city and that kind of stuff, but that's not common. And to really improve the quality of healthcare as a
Mm-hmm.
standard, that's something I would really love to do.
Okay. Yeah, and I think that's an amazing goal, because also it's one of those things when you kind of drill down from the data, like a patient really isn't a statistic. It becomes a very personal thing. And I think especially, I'm not a parent, but obviously I remember when my mother would carry me to the doctor, or even when I see parents, when they come in with their babies, or I've had friends, and their children have all sorts of cancers and so on. I know it's terrifying, because you love this little person. And of course, I've known people who, if it's kids or if it's other things, like they lose their babies and they just, they move on, but they don't necessarily recover,
Exactly.
although they move on. So when you're able to improve those things, it even to one family, it's just amazing to be able to have your child be well again. So I am so glad this is happening. I think you are super duper worthy, and it has been a pleasure to support you. And I'm just looking forward to seeing how you do, and if you go on to fellowship or whatever. So it's been amazing. So thank you for chatting, and thank you for sharing your wisdom with other people who are coming along, because I know that when people are able to see other people who've done it, especially if they did it on a second try or a third try, that sometimes it gives them the juice to go after it. And why not, So definitely, thank you, Darren.
Yeah, I just want to say thank you. I mean, I don't know how much is, the magnitude of thanks I could extend, but I really, really want to thank you, because I'm telling you, when I did match, I felt really, really, really horrible. And I know for people out there who have tried before and didn't match, it's a horrible, horrible feeling, especially I have other friends who matched.
Yeah, right.
Yeah. So I really, really want to say that being able to work with you, sending that essay, the points of the essay, what I'm trying to convey, learning how to really bring what I have in terms of the background and the experience into something that is black and white and could really stand for something through the whole application process. I mean, I really, really appreciate it, because it made clearly it made a big difference.
Yeah.
Because you can't change your scores, right? So as I said, you have to go and do your best. Pass on your first attempt. I passed on your first attempt, but you do your best with your scores. And then you leave everything now to the application to give you the interview. So and
absolutely. And you turn it up when you get to the interview. You make
and then you do.
Yes. I am here.
Yeah.
This whole thing actually is kind of fun for me, because I think it gets to be a lot of fun when you get to the place of recognizing that, hey, I need this program, but this program also needs me. And I think if you get to the stage where you really believe that, and you can see it because you've itemized the things, it just, I mean, I know it's like you're going through the process, so it can be nervous for you, but it can also just be a lot of fun. Like, hey guys, yes, it's me, the one you've read about, I'm here.
Yeah, that's right, the one you've read about. I love that.
Oh my goodness. All right. All right, well, thank you. You were just at work, right? So you're gonna rest for the rest of the day?
Yeah.
Okay, cool.
Yeah.
All right, well, thank you, Darren.
All right.
Take care.
Thanks.
Bye.
Bye.
All right.